Hello, good afternoon everyone. Thank you for joining us in this live session. My name is Darius Yadegari. I'm a general dentist. I have over 8 years experience in the field of dentistry, and I'm working with Medcare for the past 2 years. I have a special interest in prevention, treating, and educating patients on matters of oral health. I'm very thankful for being given the opportunity to talk on today's topic, preventing dental cavities, because dental is a cavity, and how do we get cavities? The tooth is made out of pulp, dentin, and enamel, which is the strongest material found in our body. A dental cavity, or also known as a dental caries, is a permanent damage to the hard surface of the tooth, which happens in time. The more it gets through the enamel and the closer it gets to the pulp, the more painful it will be. But how do we get it, and how do we reach to that point where the tooth structures are damaged permanently? First, we have to keep in mind that our body and also our mouth is home to a multitude of microorganisms. These microorganisms live, multiply, eat, and create waste just as any living organism. The oral cavity, our mouth, is the first step of the digestive system. Whatever we eat and whenever we eat something, the process of breaking down of foods into smaller particles which will be easier absorbed by our body, it starts in our mouth. During this process, which is carried on by the bacteria, especially by the biofilm of bacteria that is found on and grows on the surface of our teeth, acids will be released. Those acids will harm the tooth structure and start the process of decay, eventually getting cavities. And now that we know what is a cavity and how do we get cavities, what can we do to prevent it, and how do we avoid getting cavities? First and most important thing is maintaining a good oral hygiene. By maintaining a good oral hygiene, we are constantly decreasing the bacterial load in our mouth, and also the food remnants will be minimal. This means there will be less bacteria in our mouth and less food for those bacteria to feed on. What it means to maintain a good oral hygiene? We have to brush at least twice a day, and advisable is brushing after every meal. While we are brushing, we have to take care that we cover as much as tooth structure and surface as possible. We have to take care that we are using a proper brushing technique, and we have to take care that we brush enough. As a rule of thumb, we advise 5 seconds for each tooth. We have to constantly use mouthwash, complementary to brushing. Mouthwash will be able to reach those spots that we are not able to reach while brushing. We have to use dental floss. By flossing, we remove any food that is lodged in between our teeth, and this will mean that will be less food for the bacteria in our mouth. Secondly, nutrition. We have to eat healthy and keep a healthy lifestyle. Nutrition is very important, and it's a very important part of our life. Whatever we eat, it reflects in our overall health and also in our oral health. We have to avoid sugary foods and sugary drinks. Sugar is a very simple molecule which will be very easily broken down in our mouth, and acids will be released. We have to avoid chewy foods and sticky foods, which will be stuck in between our teeth, and which, if they are not removed immediately, it will be a feast for the bacteria in our mouth. We have to eat a lot of vegetables and fruits. Besides the fact that they are packed with beneficial minerals and nutrients and vitamins, they also clean the teeth, and they also stimulate the salivary glands, which will secrete more saliva and will neutralize the acidity in our mouth. Third thing will be regular dental checkups. I always advise everyone to do a checkup at least every 6 months. The dentist will decide if whatever you're doing is properly done, or if there is anything, it will be very easily fixed. For patients that have deep grooves and deep crevices on their molars, which act as a trap for food, the dentist may recommend doing fissure sealants. I always tell my patients nothing major can happen in between 6 months. Even if anything happens, it will be very easy to fix for the patient and for the doctor as well. Keeping this in mind, I always tell everyone prevention is much better than treatment. Thank you very much. Dean, if there is any question, I would gladly answer.
Good afternoon, doctor, and
Good afternoon.
thank you for covering like the insights about what exactly you explained very well what a cavity means and what are the causes of the cavities.
Thank
Like
you.
you explained, the sodas and the sugars they affect the teeth and they cause cavities. So I would like to ask everyone to kindly actively participate, and if you have any questions related to dental cavities or dental hygiene, you can just put your comment on Instagram and Facebook. So, doctor, I have one question already here right now. So, it says, what are the signs and symptoms of tooth decay and cavities? So, like, I would like to just elaborate on this question a little more. So, sometimes a person might have a cavity and he might not know it unless he visits the dentist. Then only he will know. Like, sometimes he has a cavity when the dentist will tell him.
Exactly. That's why the third step is very important, because at an early stage, the cavities are asymptomatic, so you will have no signs and no symptoms, or maybe sometimes you will have a small black spot or a discoloration on the tooth. And this can be observed only by the dentist. If the cavity advances, as I first said, through the enamel and it gets closer to the pulp, you will start feeling sensitivity and pain.
Okay, thanks, doctor. Doctor, what about if you have a small cavity? Is it treatable at home? Can we do something like will brushing or flossing help to treat the initial cavity, or do we need to visit the dentist and get the treatment done?
A cavity is a permanent damage to the tooth structures. It cannot be reversed. It can
Okay.
only be fixed in the dental department, and we will remove that damaged structure and we will fill it with filling materials as composite or glass cement ionomer or
Okay, got it. Thank you. So, if a cavity is between two teeth, say in case, so if you treat, if it's treated that time, it will not spread, right? And if it's not treated, will it spread to the other teeth?
Of course, in time, the cavity will advance towards the pulp, and it will reach at one point where the pulp will get infected and we will reach more difficult treatments. It doesn't matter where the cavity is placed, it has the same course, and we have to treat it as early as possible.
Okay. Doctor, another question I have here from one of the people is, can a cavity be treated in a single visit at the dentist, or do the person has to come again?
Most of the time, cavity is treated in a single visit, but sometimes, depending on how deep it is, it will need more visits.
Okay. So if it's deeper, then I guess it would require filling. And then what are the kind of things that are needed to do the filling?
Any cavity, the treatment for any cavity, it's a filling.
Okay.
But sometimes, if the pulp is infected, we will have to do a root canal and clean the pulp and clean the roots of the tooth. And this treatment needs more sessions.
Okay. So if it's a root canal, it needs more
It-
session.
it-
If it's small
it-
cavity, then it's treatable on the
In
same
one
day.
session.
That's nice, doctor. So, doctor, I think many of them would be interested to knowing this answer of this question, which I'm going to ask you, is does it hurt while getting a cavity treated?
As I said at the beginning, it depends on the magnitude of the cavity. If it's very deep, the dentist will give you anesthesia and you will not feel anything.
Okay.
If it's small, there will be absolutely zero pain without anesthesia.
Okay. Okay. That's good. What about dental floss, doctor? Like, does it help by any chance to treat a tooth decay or prevent a tooth decay
Floss,
besides the normal brushing of the teeth?
flossing is very important. The tooth is made out of 5 sides. The occlusal side, which is the top side,
Okay.
the mesial and the distal side, which is the lateral sides, and the palatal and buccal, which is the front and back side. When we brush, we only cover 3 sides: the top, the front, and the back. The lateral sides, we are not able to
ignore
brush.
it,
We
actually,
ignore it.
yes.
So what the dental floss is doing is cleaning those sides, and any food that gets trapped in there or any bacteria that it's growing there will be removed by the dental floss.
Okay, so it's very important to do
It is
to
an
brushing of
important
teeth and
stage,
also doing the floss.
of course.
So, how often do you recommend this flossing? Is it the same time as using a toothbrush, or?
No, I recommend everyone flossing at least once per day at night before going to sleep. Because flossing, if it's not done properly, it can harm the gums. So you should always take care to floss properly and not go inside the gums.
Okay, so it's better to do it at night because after dinner you're sleeping
You
and
will
it might
sleep
remain in your
exactly, and there will be no food for the bacteria in the mouth to feed on the whole night.
teeth. Got it. Got it. Doctor, when we choose a toothbrush or a toothpaste, like how do we choose the right one?
Many people ask me this question, and everybody is surprised by my answer. Toothbrush, I always advise everyone to use a soft toothbrush. If they don't like the soft toothbrush, maximum a medium brush. But toothpaste, because bacteria is like any other living organism, they have the ability to adapt and to change. I always advise everyone to change constantly the toothpaste. So whenever you are finishing one tube, you will change to another brand and another brand and another brand. This way, the bacteria in our mouth will not have time to adapt to the ingredients found in the toothpaste.
Got it. Got it. That's very nice. Doctor, how can we prevent cavity in toddlers, like children?
In toddlers, I always advise the parents, and it's very important that if they are not able to brush their teeth, at least to wipe their mouth and their teeth after every meal,
Okay.
especially at night. Especially at night.
Okay.
And toddlers should never be left with the bottle in their mouth to sip on milk, and should never sleep with the bottle in their mouth.
Okay. I hope that answered your question. That's a very nice question. I request everyone to kindly participate. If you're not clear with the answer, you can still ask another question. Thank you. So, doctor, then one more question I would like to ask you is using a mouthwash safe?
Of course, it's safe. Mouthwash is complementary to brushing. Whatever areas we are not able to cover with brushing, the mouthwash will be there to eliminate any remnants of bacteria that is in our mouth.
Yeah, true. Also, I think the mouthwash would help because there's another question here. It's kind of related. It says what causes bad breath and how can this be treated? So, one of the ways it can be treated is by using the mouthwash, right? The bad breath can disappear.
Bad breath, it's mainly caused by dental cavities or food that is lodged in between our teeth and it's not removed.
Okay.
So bad breath can be treated only by removing the dental cavities and fill it, and removal of any food remnants in our mouth.
Okay. That's fine. So, doctor, when we say, like, when we talk about cavities and if the cavity is small, of course, you said we need to do it, clean it that time, and we can do it in the same session. So, doctor, and you also mentioned that if the cavity is deep, then we might have to do a treatment and it might require more sessions, and if it's a root canal, etc.
Sure.
So, what are the different types of dental fillings that are available or that you use in your clinic?
Mostly we use composite filling, but there is other fillings available. There is glass ionomer cement filling, which we use in kids mostly.
Okay.
There is amalgam filling. It's not used anymore that much. And there is also ceramic filling, which has an onlay or inlay, which will take more sessions to fix. And it's according to the magnitude of the cavity and how deep it is and how big the filling it will be.
Okay. Thank you, doctor, for answering that. Uh, so, there's one more question here. What causes sensitive teeth? So I believe, as you explained, that the cavity, of course, is one of the factors.
One of the factors.
So, is there any other like things that cause sensitive teeth?
Drinking a lot of acid drinks will cause sensitive teeth. And brushing too aggressively, when you brush too aggressively, the gums will recede. That part of the tooth, it's more sensitive and it's
Okay.
a very good thermal conductor. So whenever you will drink and eat something, it will be sensitive.
Okay, got it. Doctor, sometimes we experience even in our daily lives that we do brush our teeth every day in the morning and the night, and we also floss. But sometimes there are still chances that a cavity is there, and we never know it, unless we go to, if there is any pain and we go to the dentist, then dentist will tell us there's a cavity. But even though you brush twice a day and even though you floss, like how can a cavity appear in your teeth?
It means you're not doing something properly. The brushing technique, it's not good, or you are not covering all the areas in your mouth, or you are not flossing properly, or you have a predisposition for genetical predisposition to cavities. That's why it's advisable to check every 6 months, because you will see at an early stage of developing of the cavity if there is anything, and it will be easily fixed.
Okay, so when that's right, doctor. I mean, most of us, we get up in the morning and we just try to brush our teeth fast. Yeah. So if you can just explain, like how much time we should take to brush our teeth and how the technique.
As a rule of thumb is to cover as much as the tooth surface as possible, and we should try and brush at least 5 seconds for each tooth.
Okay.
This will be around 2 minutes overall.
That's 2 minutes. Okay. I think this should help. This answer should. I mean, many people, in our daily life, we get busy. We just get up in the morning, brush our teeth. But I feel we should take care of our teeth, and I mean, we should really take time to brush our teeth.
Of course, prevention is much better than treatment.
Of course. Doctor, one more question here is when food is stuck in between our teeth, like you mentioned, there's a possibility of getting a cavity in that place. So sometimes we use a toothpick to get this food stuff out. So does it affect the gums and does it affect the teeth? Is it good or?
It's very bad. Toothpicks are very bad. You should never use a toothpick. The toothpick will always irritate the gum, and the gums will recede.
Okay.
And it will create some pockets. Those pockets will act as a trap for the food and for the bacteria, so you will find yourself in a bad circle. The more you use the toothpick, the more the gums recede, and the bigger the pocket it gets, and more food it will get stuck.
Okay. So the best way, the cure for that is probably only by brushing and flossing.
Brushing and flossing and using mouthwash.
And using mouthwash, okay. Doctor, what about wisdom tooth when it comes? Does that make space for cavities next to the other tooth? There's a question over here. So
no, the wisdom tooth, when it comes out, it doesn't make space for cavities. The only thing that happens while the wisdom tooth comes out, it's called pericoronitis, and while it comes out, it will be covered by the gum, and under that gum, food will always get trapped. That's why people sometimes experience pain. That food, when it gets trapped in between the tooth and the gum, it will rot and it will irritate the gum, and the gums will get swollen and so on. The pain process will start.
Correct. So, like you said, it's okay. I mean, you have to brush your teeth and flossing. That's the best practice.
When we
Also, the
have this
mouthwash.
kind of situation where you have to brush your teeth and you have to take care that food never gets stuck under the gum,
Okay.
between the tooth and the gum, and you have to always use mouthwash.
Okay, okay. So as far as I know, doctor, there are, I mean, three types of brushes, maybe soft, medium, and hard. So how does a person choose this kind of brush?
Toothbrush, maximum the medium brush. Irritated, they will recede. Once the gums are receded, it will be very difficult to fix them back, to make them grow back downwards.
Okay.
So we are not polishing the teeth when we are brushing. We are only removing any biofilm of bacteria
Or
on our
food
teeth
that is stuck.
or
Correct.
food. At least so every 3 months, it's advisable that you change it.
Okay. So doctor, how often do you recommend a person visiting the dentist? Because sometimes, as you said, the cavity is a small thing and it grows over time. Even though we brush our teeth, we use mouthwash, flossing, we don't know about it. So, what do you think a person should? How often should he visit the dentist?
I advise everyone to visit the dentist at least every 6 months. Nothing major can happen in between 6 months, and even if something happens, it will be very easy to fix for the doctor and for the patient also.
Got it. So, doctor, sometimes like we don't often go to the dentist. We brush our teeth at home. So, is there any way that to know that we have been starting the cavity started in our teeth, or do we just wait for the pain and then go to the dentist?
Unless you get any sensitivity or you notice any black spots or black marks or discoloration on the tooth, you will not be able to recognize the cavity in the early stage.
Okay, that's nice. So, doctor, what are the early stages of dental trouble? Like, when should we really, I mean, the cavities and all, it's like kind of common that we can be treated in the single session, like you said. But sometimes, as over time, we don't understand what problems we have. Sometimes, as over time, we don't understand what problems we have in our teeth, like dental trouble.
The signs of bad oral hygiene is bad smell, bad breath, bleeding gums, and sensitivity. So whenever you notice that the gums are bleeding, it means you're not doing something properly. You are not brushing properly, or you're not removing all the biofilm or all the bacteria in your mouth. So bleeding gums is a sign of bad oral hygiene.
Okay. Doctor, when you say a decayed tooth or maybe just a starting part of getting a cavity, so is it okay? I mean, sometimes we'll not go to the dentist just because it's a small thing. We think it will heal on its own. Is it true that can it be, even if it's a small dot, black dot on a tooth, can it be treated at home?
No, never.
So you must visit the dentist,
You
right?
must visit the dentist. The earlier you go, the easier it is to be fixed.
So can you just explain to us, doctor? I know we have covered a lot of, doctor has given answered most of the questions which you guys have uh, commented on Instagram and Facebook. So I think, doctor, we can just conclude by, you can give us the tips, the top 5 tips for cavity prone teeth.
5 top tips would be maintaining a good oral hygiene, brushing at least twice per day, using mouthwash, a good and healthy lifestyle, eating lots of fruits and lots of vegetables, avoiding sugary drinks, avoiding sugary foods, avoiding sticky foods also, and also always doing regular checkups.
Okay. Thank you, doctor. So I guess we have a last question. We have time. We just have 4 minutes for the last question. So I'm just going to shoot this to you, doctor. So for kids like 7 to 8 years old with bad cavities, is it okay to let it be and wait for the teeth to fall out and be replaced with permanent teeth, or should we get the root canal done? How does it work?
No, a cavity should always be treated, even if it's a kid and even if the tooth will change, because if it advances, it can damage, first of all, it can damage the permanent tooth. Second, you may need to do extraction and it will create disturbances in the tooth eruption and alignment of the tooth. So It doesn't matter if it's a permanent or primary teeth, it has to be treated.
It has to be the, or else it will spread to the other teeth.
Exactly.
Right? Or it can give some other problems. Okay, thank you, doctor. You have covered
Thank you very
most
much.
of the
Thank you for having
questions,
me.
and thank you everyone for actively participating. We covered a lot of questions. I hope Dr. Darius answered your questions. So, if you have any other queries or if you want to consult Dr. Darius, he is available in Medcare Medical Center JBR and Medcare Medical Center Discovery Gardens.